Hello, and welcome to today's presentation on filling the gaps for research investments in cannabis and mental health. My name is Sheldon Mellis, and I'm a program manager at the Mental Health Commission of Canada. Specifically, I work on the mental health and substance team, and I oversee the cannabis and mental health file at the Commission. Before I start today's presentation, I would like to pay my respect to the land in which I reside and the Commission is located by acknowledging the traditional unceded territory of the Algonquin Anishinaabe people. I'm grateful to have the opportunity to be present in this territory, especially during these times where we are spending more time outside and appreciating the beauty of this land. In today's presentation, I'll be providing an overview of how the MHCC is filling the gaps in research to explore the relationship between cannabis and mental health. I will start with providing a timeline of our journey. Following that, I will provide an overview of the various steps and actions we took to inform and guide our research investments. I will then dive into our various research investments, and you'll see where we are going to be putting our efforts as it relates to knowledge exchange and translation. And finally, I would like to take some time to thank our partners and collaborators for the success of this initiative. Here's the timeline of our journey. As you can see here, our work started following the legalization of recreational cannabis in Canada. In 2018, MHCC received $10 million from the federal government to investigate the risks, harms, and benefits as it relates to cannabis use and mental health. Before we kicked off our investments in the various research streams, we commissioned an environmental scan and scope review to guide our work and to ensure we understood the gaps in the research, priority areas of research, and the priority populations. Following that, we facilitated a community-based and Inuit-led forum to understand how our research investments can better support and be influenced by people with lived and living experience. In 2019, we launched our first call for research, where we funded a suite of cannabis research projects to strengthen the evidence base and expand cannabis research related to mental health. In 2020, we invested into larger scale research projects that spans over 5 years, funded a suite of projects from across Canada grounded in community-based research principles, and started a dialogue series to explore research priorities as it relates to cannabis, substance use, and mental health within Black communities. Most recently, we funded additional cannabis research projects, which will span over the next year. Although most of the research continues to be underway, we have prioritized sharing and disseminating the research generated to date to inform key stakeholders and Canadians on the research progress made on cannabis and mental health. And of course, continued efforts are going to be made to ensure that we are translating the knowledge, research findings, and the results as they become available. Now I will take us on a deeper dive on the steps that we took to get us to where we are today. As I mentioned, MHCC engaged a team of researchers from the University of Calgary to conduct an environmental scan and scope review to analyze the existing research into the relationship between cannabis use and mental health outcomes. The scan and review set out our path on where to and how to invest our funds into research on cannabis and mental health. Specifically, it identified the knowledge gaps in cannabis and mental health literature and informed our research agenda as well as policy development. We discovered that research must be grounded in an understanding of the complex context of cannabis use, which can include existing mental health problems or illnesses, polysubstance use, and factors unique to specific populations, including the need to look more broadly at the effects of cannabis, in that we must go beyond only studying its possible harms by considering potential benefits outside problematic use patterns. In addition, nuanced approaches to the study design and the interpretation of results will be critical in helping us understand the relationship between cannabis use and mental health outcomes. Overall, what we learned is that research needs more specificity, which is what we seek in the design and makeup of our calls for research and investments in funding opportunities. This approach has allowed us to target our research investments while effectively filling in the gaps in cannabis and mental health research. If you would like to learn more about the findings of the environmental scan and scoping review, I encourage you to visit our website to download the summary report as well as the webinar presentation, and feel free to reach out to me should you want a full copy of the report. Through our environmental scan, as well as meeting with a number of communities across Canada, we discovered that there are a number of needs in cannabis and mental health research. Through our research investments, we endeavor to accomplish the need for 1. high-quality research across various methodologies, and that more qualitative research needed to complement, validate, and provide more subtlety to quantitative findings and those of other approaches, including centering the insights for people with lived experience through qualitative methods, including research into the motivation for and the potential therapeutic benefits of casual and moderate cannabis use. Secondly, further clarity on relationship between cannabis use and mental health by asking the question, does cannabis use contribute to mental health problems and illnesses, and vice versa, and investing into longitudinal studies to examine the relationship between the two. Thirdly, the need to explore specific modes of consumption to determine how these affect outcomes. For example, how does different modes of consumption, such as inhalation, ingestion, and in the case of many rodent models, injection, impact mental health outcomes? Lastly, the need to explore the intersections of priority populations and the social determinants of health. There's very little research that focuses on seniors, First Nations, Inuit and Métis, 2S LGBTQ+, immigrant, refugee, ethnocultural, and racialized populations. Research also needs to take into account social determinants of health, such as age, sex, gender, income, education level, and past experiences of trauma. In addition to the research needs identified in the environmental scan and engagement with communities, priority populations were also raised as an area of focus that needs to come through and be represented in our research investments on cannabis and mental health. These populations include people with lived and living experience of cannabis use and no mental health problems or illnesses, members of First Nations, Inuit, and Métis communities, immigrant, refugee, ethnocultural, and racialized populations, two-spirit, lesbian, gay, bisexual, trans, and queer persons, communities who experience layers of oppression, for example, people with experiences of homelessness, people who have been involved in the justice system, people who do sex work, and people who sell or buy street-level substances. And as I mentioned before, it's also important to capture how the social determinants of health, such as sex and age, interplace into the mental health experiences and cannabis use of individuals and communities that represent these populations. The relationship between cannabis and mental health is shaped by personal, social, political, and economic factors and gives rise to questions about health equity, human rights, social justice, and more. The MGC supports a holistic policy approach on the relationship between cannabis and mental health. Such an approach seeks to reduce harms, understand potential benefits, and apply evidence-informed policies and practices rooted in the social determinants of health. Our work is informed by people with lived and living experience of cannabis use and/or mental health problems and illnesses, and by communities and community organizations. In light of the current evidence on cannabis and mental health, the following priority research areas were identified through the environmental scan and scoping review, as well as community forums. Cannabis and its effects, factors that influence why people use cannabis, cultural practices and beliefs around cannabis use, diverse populations of cannabis use, consumption patterns across groups and regions, impacts of criminalization for people who use or sell cannabis and other drugs, impacts of legalization, stigma, trauma and suicide, informing care providers, and finally, effective public education strategies. To ensure our work and research investments were impactful and meaningful, we knew that we had to meet with community members from across Canada to learn from them on how to best invest our research dollars. Over the years, we've been very fortunate enough to meet with a number of communities and leaders and researchers to learn from them on what priorities are needed as it relates to cannabis and mental health research. In July 2019, the Mental Health Commission of Canada brought together more than 60 experts, including people with lived and living experience of substance use and mental health problems and illnesses, family members, policymakers, service providers, and community-based researchers to discuss funding priorities for community-based research on cannabis and mental health. Of course, all the participants brought knowledge to inform studies that benefit communities, individuals, and research. In the end, we published a report that provides an overview of community-based research while centering lived experience perspectives, As well, this report includes recommended priorities for research on cannabis and mental health. The results of this forum has ultimately guided our work to ensure that our research investments are closing the gaps as it relates to the research needs of communities. In October 2019, we co-hosted an Inuit-led forum in partnership with Nunavut Department of Health and Social Development, Inuit Tabuit Katanami, and the Canadian Centre of Substance Use and Addiction. This forum represented the first opportunity for Inuit across Inuit Nunavut to meet to discuss cannabis mental health in order to exchange knowledge and to identify research gaps and priorities. Topics included cannabis use and access, risk, benefits, challenge, and best practices. In December 2019, we kicked off a dialogue series that brought together researchers, academics, community organizations and leaders, service providers, and most recently, we held a session that brought Black people with lived and lived experience to discuss research priorities in Black communities as it relates to cannabis use, substance use, and mental health. We are currently in the process of developing the final report that will highlight the research gaps identified, as well as research priorities in these communities and recommendations for funders and researchers to better support and serve Black communities. This report will be available on our website in summer 2021. I'm pleased to share with you today where the MHCC has invested our funds as it relates to cannabis and mental health research. Over the last few years, we have invested approximately $7.2 million in various academic and scientific-based research. 20 of these research projects are catalyst research projects, and these projects are here to strengthen the evidence base and expand cannabis research related to mental health, as well as to build cannabis-related research capacity and to inform the development of future larger-scale research projects. These research projects vary in diversity and are inclusive of the priority populations, research areas, and research needs as identified through our environmental scan, scoping view, consultations, and what we heard from various community forums. To highlight a couple of examples of projects that have come out of this way of research, we have a number of projects that are exploring the relationship between cannabis use, mental health illness, and problems with Canadian veterans. For example, we recently funded a study coming out of the University of Alberta that will explore the perceived benefits and adverse effects on the type, source, and dose of cannabis in relation to perceived benefits and harms to veterans and their family members. The results of the study will be essential in understanding the risks and benefits of medical and recreational cannabis use by Canadian veterans. Another study coming out of the Centre for Addiction and Mental Health will examine the experiences and perspectives of IRER individuals who live with mental illness, use cannabis, and are in contact with the mental health sector across Ontario. This project seeks to give a voice to IRER community members' experiences and perspectives on the relationship between cannabis and mental health. In addition, we have funded 4 team-based research grants to explore in more detail the potential therapeutic benefits and harms associated with cannabis use in a number of targeted areas to strengthen the evidence base and to build cannabis-related research capacity. Finally, we have 2 co-funded policy-based research projects in partnership with CCSA to address the gaps in the data about cannabis use in Canada and to gather knowledge in areas that are lacking research in order to support study of the impact and effectiveness of cannabis policies, regulations, and programs. The evidence generated from these research projects will inform the development of policies, programs, and practices that will optimize a public health approach to non-medical cannabis use. This large investment in research could not have been done without the support of our co-investors and partners. This includes the Canadian Centre of Substance Use and Addiction, the Canadian Institutes of Health Research, Veterans Affairs Canada, Schizophrenia Society of Canada, and the Canadian Consortium for Early Intervention in Psychosis. Next up, we have the community-based research projects, where we funded 14 projects from across Canada totaling $1.4 million invested into this suite of research. What makes these projects unique are the fact that they're grounded in community-based research principles and approaches. This includes all participants contribute to all phases of the research. Researchers and community members recognize each other's expertise. There's a balance between rigorous research and tangible action. The partners commit to a long-term relationship built on trust, collaboration, shared decision-making, and shared ownership of the research. In addition to producing research results, the project builds local capacity and sustainability. Like the other research investments, the community-based research projects cover an array of research areas, address research needs, and are led by community members that are in line with the priority populations identified in the initial scope of research. 6 of these research projects are Indigenous-led, First Nation and Métis, and these projects examine the relationship between cannabis and mental health as it relates to their communities while incorporating their social, cultural, and traditional contexts using Indigenous research methodologies. One of these Indigenous research projects is being conducted by the Thunderbird Partnership Foundation, and their study will be addressing the stigma of parental cannabis use among First Nations through community engagement and policy. This will all be done through discussion, and in the end, the project will develop an accessible prevention and harm reduction tool for use by First Nation, in addition to toolkits and resources that will be developed for social service organizations. Another project of the 14 will be led by immigrant, refugee, and ethnocultural, including racialized youth. This project is coming out of Ottawa and will be carried out by the Centre for Resilience and Social Development. This project seeks to explore how IAR youth access and use services related to cannabis and mental health, including their unique factors affecting the use as well as outcomes. Results of this project are expected to inform how researchers can effectively understand and measure the prevalence of cannabis use among IRER youth. Now that we have successfully funded 40 research projects, we took stock of the projects and determined how these projects are going to be impacting both the research community as well as Canadians. So from our analysis, we determined that the evidence-based interventions for the treatment of and management of cannabis use disorder will come through in these research projects. These research projects will also enhance stigma reduction initiatives and public education on cannabis use. There'll be more knowledge on the relationship between youth cannabis use and mental health outcomes. The research will strengthen the evidence base on cannabis use for insomnia, concussion, PTSD, psychosis, and autism disorder. And finally, it will inform on how mental illnesses influence cannabis use across diverse populations. So what now? We've completed investments into research, and all of the projects are currently underway despite experiencing delays due to COVID-19. We are working closely with all the 40 research teams to determine the best methods and opportunities to share and disseminate their research results and findings across research communities and to Canadians. You would have seen that the reports from our initial scope of research and engagements with communities are available online. And as research results and findings are generated, we'll ensure that this important information is shared broadly and is made accessible to all audiences. This will be done by publishing digestible reports and summaries, including infographics. We'll be launching a webinar series. We will also be having a video series that will showcase as well as demonstrate the research projects. We'll be attending conferences and facilitating presentations. And finally, we are working with the Schizophrenia Society of Canada and YouthRex to develop a cannabis and mental health course for youth and by youth. This course will be launched this year, and we're very much looking forward to it. Before I finish my presentation today, I just want to take a couple of minutes to thank our partners as well as collaborators. Firstly, I want to thank the Center for Community-Based Research, National Collaborating Center for Indigenous Health, Center for Healthy Communities, Inuit Taparit Kanatami, Wellesley Institute, National Collaborating Center for Determinants of Health, the University of Calgary, our Executive Advisory Committee, who have been a strong supporter in our work, Dr. Kwasi Awazi Bimpa, the Canadian Institutes of Health Research, the Canadian Centre of Substance Use and Addiction, Veterans Affairs Canada, Schizophrenia Society of Canada, the Canadian Consortium for Early Intervention in Psychosis, and finally YouthRex. Definitely without these partners as well as collaborators, we would not have been successful in our work. So I just want to thank all these organizations and individuals for their time and effort in the success of our work. Stay up to date on our work by following us on social media, including visiting our website where you'll find additional information on our research investments, reports, and resources. On behalf of the Mental Health Commission of Canada, I would like to thank the organizers of the 2021 Michael G. DeGroat for Medicinal Cannabis Research Conference for inviting us to present on our work and impact in the space of cannabis and mental health research. Thank you et merci.